In part 6 in our lab of the axial skeleton, we'll take a look at the vertebral column. So the vertebral column consists of 24 movable vertebrae. If you take a look here at this gentleman, if we start way up top here, all of these bones form the vertebral column. We count them all up, which we will. They consist of 24 movable vertebrae. So each bone is movable. Those vertebrae sit on this bone right here. This is known as the sacrum. And then way at the bottom, this little piece down here is known as the coccyx. All right, so the vertebral column, and it's also called the spinal column, consists of 24 movable vertebrae, one sacrum, and one coccyx. Let's take a look at the regions of the spine. So the uppermost part of the spine is known as the cervical spine, and you need to know that consists of 7 cervical vertebrae. The middle back is known as the thoracic spine, and that consists of 12 thoracic vertebrae. The low back you may know as the lumbar spine consists of 5 lumbar vertebrae. Right? Most people kind of know the lumbar spine as their low back. You may have in your car a lumbar support, right, which supports your low back. So 7 cervical, 12 thoracic, 5 lumbar. I want you to note also, see how the vertebrae, we can abbreviate them. Instead of saying, thoracic number 5, we could just say T5. Or let's say a patient has arthritis at C5, right? Instead of writing out cervical 5, you could just put down C5. So we use the first letter and then the number of the vertebrae, right? If a patient has a compression fracture at T11, right, you know that's the 11th thoracic vertebrae. Or how about this? A patient has a herniated disc between L4, L5, right? So again, it saves us a little bit of writing. Here's a model showing the vertebrae again, the 7 cervical. All these are the 12 thoracic, all the way down, and then the 5 lumbar. We have the sacrum, and a little bit over here you can see the coccyx. Now, the next thing we want to take a look at, it doesn't show it on this model, nor does our previous picture show them, but between the vertebrae there's a cushion, a disc. This is going to be called the intervertebral disc. So all of these vertebrae have discs in between them, and they help with shock absorption. It helps to absorb shock in the spine. Again, they're not shown here, but all the discs would be in these spaces over here. Let's take a look at the anatomy of a disc. If we were to kind of slice a disc and look into it, we're going to see that it has 2 parts. The outermost part, and this is made up of fibrocartilage. If you remember from the tissues lab, we said that any disc in the body was actually made up of a type of cartilage known as fibrous cartilage. This fibrous cartilage out here, I need you to know, is called the annulus fibrosus. And it's just rings of fibrocartilage. Kind of reminds me of an onion, right? You would just have rings of onion layers. Well, it's the same thing here. We have layers and layers of fibrocartilage, annulus fibrosus. In the middle, about the consistency of like toothpaste, is a ball of jelly called the nucleus pulposus. Okay, so those are the 2 parts of the disc that I'd like you to know. You don't have to know this down over here, but the rings of the fibrocartilage we call lamellae. Again, you may remember from the tissues lab, lamellae were rings. Let's go back a moment. The last thing that I want to show you is if you look at the spine from the side, you'll see the direction of the curves are not the same. For instance, in the cervical spine, the curve goes forward like this. The convexity is forward. In the thoracic spine, you can see it nicely here. The convexity is posterior. And then in the lumbar spine, it's going to be anterior. And the sacrum is posterior. When we're born, if you know what the fetal position is, our spine is one big C-shaped fetal position. That changes as we develop. once we start to lift up our head, instead of this curve being faced backwards, like the convexity being faced backwards, it changes so that the convexity faces anterior or forward. So since this curve changed direction after birth, we call it a secondary curve. It's about the time that we start to hold up our head and lift our head up, that type of thing. The curve changes direction. So the cervical curve is a secondary curve. It changed direction after birth. The thoracic curve, you can see, stays in the direction of the fetal position. So it's facing backwards. If you were to kind of curl your spine, so you curl your body forward, where your spine would stick out back here in the back like this. This is the primary curve. And then the lumbar spine changes from primary to secondary about the time when we start to stand. Again, every baby is a little bit different. 7 months, 8 months, 10 months, 11 months. Everybody's a little bit different. But you'll see that the curve here changes to also facing anterior. So the two curves that are primary curves, right? They're there in that direction from the day we're born. The primary curves are the thoracic curve and the sacral curve. The two that change direction and become secondary curves are the cervical curve and the lumbar curve. Right? So we expect to see this kind of S-shaped curvature to the spine when we look at it from the side. We wouldn't want to see that S-shaped curve from the back. Right? That's a condition called scoliosis, and we talk about that in a pathology class. Okay, let's switch over now. If you can grab your checklist. This is on the spine and the thorax, this checklist. If you take a look at it, you'll see that there's 3 columns. The first column will take a look at the features of a typical vertebrae. So the very first column, that first section up top, here we're going to review all the different features of a typical vertebrae. Once we know them, believe it or not, we know a lot of the vertebrae right off the bat because they're all the same. Then we can take a look at each spinal region and see how they differ, I should say, from the cervical spine, how they differ from the thoracic spine, and how they differ from the lumbar spine. And then we'll take a look at vertebrae that just don't have typical features. So again, we're going to be on I'll follow the checklist. I'll kind of go in the same order so that you can follow along with me. The first part of a typical vertebrae is this big part right over here. This is called the vertebral body. Now, on your checklist from the vertebral body, I have something called the neural arch. So if you follow my cursor now, I'm going to go to this part of the body right here, and we go all the way around the back like this. We're going to form an arch or an arc right back to this side of the body. All of this is going to be called the neural arch. And I put in your notes, there's 2 bones that form the neural arch, the pedicle and the lamina. So let's look at the pedicles first. So this post right here coming backwards off the body, we see it on the right side here and then on the left side here, this is known as the pedicle. That's what it looks like from the top. From the side, here's the body, this chunk of bone right here, it's like a post. This is known as the pedicle. The 2 bones that close up this hole in the back right here, this is the lamina on the left, this is the lamina on the right. Again, this is the vertebrae is facing forward, so this is the left side of the vertebrae, this is the right side. Again, I'm not too concerned that you know left or right, just I don't want to confuse you if you think I have it backwards. So this is the lamina, this is the lamina here. Right, so the pedicles here and the lamina in the back, they form this neural arch. So between the body in the front, the pedicles on the side, and the lamina in the back, we've created this big hole right here known as the vertebral foramen. This is where the spinal cord is going to be housed. Now, in one vertebrae alone, we call that a foramen. If you remember from our previous labs, a foramen is a hole. But if I were to stack up a bunch of vertebrae, we would then form a vertebral canal. So those are the main parts of the vertebrae. What I want to show you now are 7 processes. So I labeled this vertebrae here, same vertebrae, but a process just think of as an extension of bone. Let's look at the 2 nice easy ones first. The ones that are coming off to the side here, and then I have one over here too. This whole big chunk of bone coming off sideways. These are the transverse processes. If you remember, transverse means across, right? So those are going to head out sideways. Going directly backwards, this is posterior. This is the spinous process. If you were to just take your fingers and go to where your upper back meets your neck and you feel those bumps, just kind of run your fingers up and down a little bit, all of those bumps, what you're feeling is right over here. You're feeling the tip of the spinous processes. Okay, so 2 transverse processes, 1 spinous. Actually, let's do this first. This is a little bit hard to see, but projecting upwards towards us here and here, this is the superior articulating process. Right? That's the superior articulating process. We're going to see that a little bit better from the side. See this projection going up like this? This is the superior articulating process. They remind me, when I look at them, when I'm actually holding a vertebrae, they kind of remind me of giraffe ears sticking up, or cat ears, that type of thing. So use them once you see that kind of giraffe ears to tell you that that's the top of the vertebrae. Here's the transverse process sticking out towards us. Here's the spinous process sticking off the back. The last 2 processes we don't see too well on this picture, but on the underside of the lamina are the inferior articulating processes. So what does these words mean? Superior articulating, inferior articulating. Articulating means it's going to form a joint. So we need the superior articulating processes and the inferior articulating processes to stack the vertebrae on top of one another. Right, so whenever you hear articulating, think that we're forming a joint. The last thing I have on your checklist, where it says superior articulating process and inferior articulating process, there is a flat point or a flat surface on the process. So this whole piece here is the process. But see this flat area here? When you pick up the vertebrae in lab, you can actually run your finger across it. That's the facet. That's the part that actually forms the joint. Right? So whenever you hear the word facet, it's usually a flat surface that's forming a joint. Okay, so what we just did is we looked at the features of typical vertebrae. By knowing those, like I said before, we know a bunch of vertebrae already because they're all basically the same. Let's compare the different regions. Let's compare the cervical region, then we'll take a look at the thoracic region, and then we'll take a look at the lumbar region just to see how they're different. So if you remember, the cervical spine has 7 vertebrae, and we said that it forms a secondary curve, just to kind of review, right? This curve that's going forward is a secondary curve. If you look at my notes, next to the word typical cervical vertebrae, so again, we're back on the table, the second section, notice I put in parentheses C3, C4, C5, and C6, right? C3 through C6 are typical cervical vertebrae, meaning that they have features that are all the same. So watch this. Here's a picture of a vertebrae from above. Notice we have a vertebral body, but the body is going to be small. If you think about it, what are we carrying in the neck, right? The cervical spine. You're just carrying the weight of your head, maybe 10 pounds, right? So it's not that heavy. So when you pick up the cervical vertebrae, look for a small vertebral body. Here's the pedicle, right here. The lamina look normal, so here would be a lamina here, right? This would be the lamina over here. All of this bone, even though it's just labeled on the top, it's really this whole bone over here. The lamina, this is another clue that you're looking at the cervical vertebrae. Large vertebral foramen. Now you think about this, when the spinal cord emerges from the brain, it's going to be bigger in the cervical spine than it is down in the, say, the thoracic spine. So a large vertebral foramen. Here's the transverse process coming out sideways. Right? Here's the transverse process here, but look at this. Inside the transverse process is a hole. We didn't see that before when we looked at a typical vertebrae. This is unique to the cervical spine. This is actually for an artery that runs up and down the neck or the cervical spine and ultimately goes into the where the brain is and supplies blood to the brain. It's called the vertebral artery. But this hole we do not see anywhere else but in the cervical spine. So this is called the transverse foramen. Okay, so in the cervical spine, the transverse process is going to have a hole. We call it the transverse foramen. Here's the spinous process, but here's another thing that's unique to the cervical spine. Look how it has a little bit of a fork to it, a little bit of a split. We don't see that in other regions other than the cervical spine. So this is called a bifid spinous. And if you kind of know that bi means two, right, you can remember that. Then here we will see the superior articulating process sticking up, and I don't have a picture of the underside, but when you're in lab you could take a look at the underside, you would see the inferior articulating process. So, on a practical, if this was sitting at your station and I said to you, identify what region of the spine this is from, this is the way I want you to think it out. I want you to say, okay, I have a small vertebral body, I have a large vertebral foramen, I'm starting to think cervical spine, but here's the confirming things you want to look for. The transverse foramen in the transverse process is only found in the cervical spine. It can't be from any other region. And then a bifid spinous is also only found in the cervical spine. You write down your answer, cervical spine, you're going to get it right. It can't be anything else. Okay? So C3, C4, C5, and C6 all look like this. They have these features. So if you go to the next section of my column 1, that means the remaining cervical vertebrae 1, cervical 2, and cervical 7 have to be atypical. Right? They're not the features that we see here. So let's take a look at the first cervical vertebrae. This is known as the atlas. So if you take a look at right off the bat, take a look at this picture, and let's go back to the previous picture. Right, this is a typical cervical vertebrae. This looks nothing like it. Doesn't look anything like it. So if you kind of look at my notes for a second, my checklist, notice I put the first 3 rows there. This atlas has no body. It has no spinous process, nor does it have lamina. Okay. By the way, we can call this C1 or the atlas. Your choice. Both would be correct. So instead of having a body, a spinous process, and a lamina, instead, in the front, this little arch right here is called the anterior arch. And in the back, look at this one. This is a big one. This big arch right here is the posterior arch. Now, since there's no body right here, we do need to be able to hold the weight of the head because the head sits on this bone. So this big chunk of bone here, it's not labeled on this diagram, but this big chunk of bone here, all of this is known as the lateral masses, right? This would be the lateral mass on the other side. That holds the weight of the head. Look at the size of the vertebral foramen here. Again, this is where the spinal cord is emerging from the brain. So the vertebral foramen is going to be large. The transverse processes are like the other cervical vertebrae. There's a transverse process, but remember, there's going to be a hole in it. That's known as the transverse foramen. And then here, this is going to be the top of the lateral mass. This is the superior articulating process. This is where the occipital condyles are going to sit, and it would be over here also. These are where the occipital condyles would sit. If we were to turn this vertebrae over, and you can do this in lab, you would feel the inferior articulating process, and that's where this vertebrae sits on C2. I don't have these on your checklist, but there's a little bump on the front of the anterior arch called the anterior tubercle, and on the posterior arch, this is called the posterior tubercle. So just to show you real quick, here is the atlas. Again, it looks like a ring. Now, this bone sits on our second cervical vertebrae right here, known as C2, or the axis. The main thing, if you can even highlight this on your checklist, I have the body there. Under that, I have the dens, or the odontoid process. Give that a little bit of a highlight or put a star next to that. That is the feature that's really different. Off of the body right here, there's like this kind of thing, I think of it as a thumb sticking up. We were hitchhiking, that type of thing, but this big bump right here, this process sticking up, this is known as the dens. Sometimes they call it the odontoid process, right? The dens or the odontoid process. And if you notice, the ring of the atlas goes right up against that dens, and now this ring of the atlas can actually rotate around the dens, and that allows us to rotate our head to the left and to the right. Most of the other features of the axis, or C2, are the same. You'll have a body, right? Here's your superior articulating processes. The pedicles would be like right about here. You got nice beautiful lamina over here. You'll have a bifid spinous process. The transverse processes are not that big, and when you look at it in lab, you will see a hole right here. That would be the transverse foramen. Again, the main thing that's different on C2, or the axis, is right here. It's sticking up towards us. That is the dens. Again, I like this picture here because we could see the two bones now articulating together. I labeled this slide as the atlanto axial joint. Atlas, axis, right? C1, C2 joint. Again, you see nicely here too. This is the lateral mass right over here. Posterior arch, anterior arch of the atlas, the dens. The last vertebrae on our column number 1 is C7. So this is a pretty typical vertebrae, but what's interesting about this one, if you look at the spinous processes of all the vertebrae, how far back they stick, look at C7. It projects back a little bit further. So they decided to call this the vertebrae prominens, meaning that it has a prominent spinous process. There's also a little bump right here. It's a little tubercle. I put that down on your notes. That little circle area here is known as the tubercle. So that's what makes C7 different. It has a long spinous process. And I like this picture because you see it best in relationship to the other spinous processes. Okay. So that's what I need you to know for the cervical vertebrae. Let's take a look at the thoracic vertebrae next. So just to review, we said the thoracic spine has 12 vertebrae, and we had said that the direction of the curve, it is a primary curve, right? This is in the direction of the fetal position. So let's take a look at the thoracic vertebrae. We actually did this already because when I showed you the features of a typical vertebrae, I happened to use a thoracic vertebrae. So most of this you're going to know already. So if this sat on a during a practical, this was at one of your stations, and I said, where is this vertebrae from? What region? This is how I want you to think it out. Take a look at the body, first of all. It's more heart-shaped. Kind of use your imagination a little bit, right? Kind of has a heart shape to it, like this. So it has a heart-shaped body. It has a round, smaller vertebral foramen. We see the vertebral foramen is smaller because the diameter of the spinal cord as it descends gets smaller. It has the superior articulating processes. It has the the transverse process, and it has a spinous process. But look at the spinous process from the side. The spinous process is downward sloping. It's pointing down. This is classic thoracic vertebrae. So again, if I was taking a practical and I saw a heart-shaped body, a small rounded vertebral foramen, and a downward sloping spinous process, I would think, or I'd start to think, this is a thoracic vertebrae. But let me show you what would confirm it for me. We didn't see this on the cervical spine because the thoracic vertebrae are going to be the anchoring points for our ribs. Each thoracic vertebrae articulates, again, articulate means forms a joint, with two ribs. There'll be a rib on the left hand side, and then there'll be a rib on the right hand side. So that means there has to be some mechanism to attach the rib to the thoracic vertebrae. And here they are. If you were to look at the side of the thoracic vertebrae, there is a facet. Again, it's a flat area for the rib. Whenever you hear the word costal, think rib. So a part of the rib is going to go here. Then the rib goes backwards like this, and it's also going to articulate on the transverse process. So there's another facet on the transverse process. This is called the transverse costal facet. Transverse means it's on the transverse process. Costal means rib, and facet just means it's a flat area. So since there's two facets for the rib, this vertebrae can only be a thoracic vertebrae. Okay? Again, these are the features in my mind. If I were to take a practical, heart-shaped body, small rounded vertebral foramen, downward sloping spinous process. On the side of the body, a costal facet. On the transverse process, a transverse costal facet. I know I would get that answer correct on a practical. This could be nothing but a thoracic vertebrae. So here's a side view. So we can see the costal facet. There's actually sometimes two. This is a superior one for a rib that would be above, and then here's an inferior one for a rib that would be below. And then here's the costal facet on the transverse process. So that would be the transverse costal facet. So let me show you two parts of the rib for a moment. We're going to go over this in the next section or the next part on our video. But this part of the rib here is called the rib head. Then there's a little constricted area called the neck, and then there's a bump. This is called the tubercle of the rib. And so it always goes head, neck, tubercle. If we were to position the rib now up against this thoracic vertebrae, watch this. The head right here is up against the costal facet. Here's the neck, and then here's the bump on the rib right there. This is the tubercle. That goes onto the transverse costal facet. So this is how our rib bone attaches to the thoracic vertebrae. Then the rib goes like this. It would go all the way to the side, and then the rib will come forward towards our breastbone, which is the sternum. And then about in here, this is where our lung would be. Okay, so these are all the features of a typical thoracic vertebrae. Okay, the lumbar vertebrae. So again, as a review, the lumbar vertebrae, we said that there are 5 lumbar vertebrae, and they are a secondary curve, right? They develop after we're born, when we start to stand and walk. So there's 5 lumbar vertebrae. There's really nothing special about lumbar vertebrae, nothing that would be unique to lumbar vertebrae. The thing I look for is they're just big. Look at the size of this thing. It has kind of a oval shaped body. The vertebral foramen is usually kind of triangular. And then it has your transverse processes, your lamina, it has your spinous process. But look at the spinous process from the side. This is something that is kind of unique, I guess. It's more blade-like. Right? See how it's more of a blade? It's not thin and narrow like the other regions we saw. This kind of reminds me of a dinosaur's bone. If you went to the American Museum of Natural History and you looked at the dinosaurs, they have these big blade-like spinous processes. So again, if I was taking a practical and this was sitting at my station, I'd look at the vertebrae and say, well, first of all, it's big. It's got this large oval shaped body, triangular vertebral foramen, and then a large blade-like spinous process. It would have to be a lumbar vertebrae, right? This would not be in our mid-back. There's no costal facets. It would not be in our cervical spine. It's just way too big. It has to be a lumbar. So here's a little test for you. If you take a look at this vertebrae over here, this is a top view and a side view. Here's a top view and a side view, a top view and a side view. see what you think. Take a moment and take a look at them and see if you can figure out which one is the cervical, which one is the thoracic, and which one is the lumbar. So let's do the cervical first. I hope you got this. This is the cervical vertebrae right here. Small body, large vertebral foramen, transverse foramen, bifid spinous. Can't be nothing but a cervical. This one is the thoracic, heart-shaped body, small vertebral foramen, downward sloping spinous process, costal facet, transverse costal facet. Can't be anything but a thoracic vertebrae. Finally, that makes this by default the lumbar, but large oval body, triangular vertebral foramen, blade-like spinous process, that would be your lumbar. You could take a look at this also. This is just a verbally showing a chart differentiating the 7 cervical vertebrae from the 12 thoracic vertebrae from the lumbar vertebrae. Everything we just went over is basically on this chart. Okay, so we'll finish up the vertebral column by looking at the sacrum and the coccyx. So we can see here the sacrum is a triangular bone. This whole flat top part is referred to as the base. And then the point of the triangle down here, this would be the apex. Now, this is an anterior view. When you pick up the sacrum in the lab, you're going to see that this is kind of a smooth surface. Everything here is smooth. Where we look at it from the back, it's more lumpy bumpy. So the posterior part is going to be more lumpy bumpy. This structure right here, where it kind of protrudes outward, this is known as the sacral promontory. The ala out here are the wings. So here's an ala, here's an ala. Now, the sacrum was actually 5 vertebrae that fused together. 1, 2, 3, 4, and then 5 down over here. They fused together. What this is showing here is this is where the disc once was. So these are remnants of the disc, and we call these the transverse lines. So these are the transverse lines. And they'd be about over there. And I think those are the most things on the beginning of our checklist. If we go to the back now, we could see that at the very top here, there's an entrance to the sacral canal. Right? If we were to take like one of our sticks in lab and push it down, it would go through this bone here and it would come out at the bottom right over here. This opening of the sacral canal is known as the sacral hiatus. On either side of the sacral hiatus, you're going to see 2 bumps right here, all that, and over here. These are the sacral cornu. Right in the middle where the spinous processes fuse together of the vertebrae, this is called the median sacral crest. Then down out over here, this is the lateral sacral crest. This represents the transverse processes. So there are going to be 2 lateral sacral crests. Right here is the one lateral sacral crest. And then out over here, right about where my cursor is, this is the other, excuse me, lateral sacral crest. Right? Only one median sacral crest because the spinous processes, there was only one coming out the middle. Now, the last couple things on the sacrum, these holes right here are just the foramen. So the holes that we see from the back we could call the posterior foramen. The holes that we see from the front you could just call the anterior foramen. Finally, if we take a look at a lateral view, this part of the sacrum here is known as the auricular surface. This is the part that's going to articulate with the ilium, that's part of our hip bone, to form the sacroiliac joint. So this here would articulate with the right ilium, and then on the other side there's another auricular surface that would articulate with the left ilium. We don't really see them, but they would be on the side here. So there would be one hip bone over here, right? The hip bone would kind of run over here, and then there would be another hip bone over here. You can see also that the sacrum is curved in the front, right? It actually curves this way. nicely smooth and it curved. The last thing we want to take a look at is the coccyx. Not too much to the coccyx. This is known as the tailbone. It also is a triangle. This is the base, and then the point down over here is the apex. And you can see it's one, two, three, four vertebrae that fuse together. These little spines right here, these are known as the cornu. They're little anchoring points for ligaments and muscles. Okay, so that concludes our vertebral anatomy. Now, in our next part, we'll take a look at the thorax.